Hey, this is Dr. Story. How do you know if you fractured a bone, whether it's a collarbone or your spine? Well, I'm going to tell you right now. First of all, I'm going to give you the answer very quickly. If you're actually on YouTube and you're asking me if you broke a bone, the answer is probably yes. What should you do? Go to the emergency room, dude. But on a serious note, how do you actually know? I get this question a lot. I get it on YouTube. People are always asking me questions. Hey, I see a deformity in my wrist or my collarbone. Is it fractured? Sometimes I'll be riding with people and they'll tell me about exercises they've done and they heard a pop in their spine. Is it fractured? I'm going to answer these questions in detail. Firstly, the most common injuries, at least to cyclists, is the collarbone, the shoulder, and the wrist. Is it fractured? Here's how you know. First of all, the collarbone, if you touch right here and you see a deformity, if the bone is sticking out like that, the answer is yes, it's fractured. If it's a partial fracture and you actually press on the bone itself and there's pain, it could be a fracture. There's different ways of fracturing the collarbone. There's a twisting type of fracture and there's a compressive type of fracture. So if it looks normal, it still could be fractured. You touch the actual bone or tap in on it. If it's painful, you need to go to the emergency room. If there's a deformity, like the bone is sticking out like that, there's no need to examine it and touch it and start tapping it. It's fractured. When this bump is bigger than this side, usually that means it's what's called an AC separation or an acromioclavicular separation. And usually this is when the person will fall down on their shoulder and it's not a compressive type of injury. This is not a fracture per se, but you still want to have it examined for that and x-rayed. But what this is a separation of a joint. Now, if you notice lower that there's a divot on the side of your shoulder after an injury, that usually is a dislocation of the humerus. Now, what do you do about these? The dislocation, you need to have it relocated. The best place to do that, of course, is a hospital because they will give you medication prior to relocating the shoulder joint itself. You want this medication. You don't want me doing a chiropractic correction and relocating the shoulder on the ground on some bike ride. You don't want that. You want it done with drugs, trust me. But having said that, there are people in the history of the world that have done this and relocated their shoulder without drugs. Those are tough dudes. What do you do about an AC separation? Now, unless it's totally deformed and now you have no function of the shoulder, you're going to have that corrected surgically. But in 9 out of 10 cases, when the shoulder is separated, they really don't do anything for it. Now, the collarbone, when the collarbone is fractured, there's various ways of dealing with it. Probably the best way would be to surgically correct it, but this is up to the surgeon. If it's a major deformity where the bone is sticking out like that, that's pretty ugly, and just from a cosmetic and functional point of view, you want to have that corrected surgically. But many people have fractured their collarbone and they have full function of their shoulder, so they never get it corrected surgically. And what ends up happening is once the pain and swelling gets better, they really don't have any problems with it in their daily life. What's interesting is I've had many patients that have fractured their collarbone and they literally had a deformity, like this, and they never had surgery. Now, the question becomes, what happens if you never have surgery for this type of condition? Well, what ends up happening is the bone actually breaks, and then over a period of time, it calcifies and it actually molds into that deformed position. And as long as you have full function of the actual shoulder joint, it really doesn't affect your daily life. But other than that, I always tell people, well, your modeling days are over, at least for the shoulder is concerned. Now, another question I get is someone will be riding our bikes and someone will say to me, hey, Dr. Story, I was doing this stretch called the Founder and I was really stretching and decompressing my spine and just stretching and I heard a pop in my back. Did I fracture my back? The answer is no. When you hear that pop, that's a separation of the joint space, and very much like a chiropractic adjustment or, let's say, cracking your knuckles, the noise you hear sounds like bones cracking, but it's actually just a joint separation. That's not something where you would have a fracture. A fracture requires a lot of force, unless the person has severe disease that would cause osteoporosis. Fractures require force. Always remember that. So if you're stretching or you're decompressing your spine or you're hanging from a bar and you hear something pop in your spine, that's not a fracture. That's just the joints releasing and is actually okay. So hopefully this was informative to you. Hopefully it answers some questions as to what to do if you have a fracture. If you like my videos, give me a thumbs up, subscribe to my channel, and have a great rest of the day.